Why is it so important to have your output measurements correct? What is all the big fuss about not spilling the urine? My students will say, Nurse Amy, you're always talking about be careful with the urine, don't spill it. Why is that important? Well, I'm going to tell you why. This is Nurse Amy TV channel. Thank you for coming to my channel. For those of you who don't know me, I teach CNA and all things nursing tips, how to study, how to pass your exams, what kind of tips with your skills. I also do lifestyle and inspirational messages. So if you're new, please, before you go, make sure that you subscribe to my channel and hit the notification bell before you leave. Hopefully, what I'm going to share with you here today is actually going to make some impactful points and put some added value to your life. So, I asked a question. What is the importance of the output? Why is it so important? Don't spill it. Don't spill it. So this is the part 2 of the bedpan and measuring output. Again, at least in the state that I teach in, you have 2 output skills. It's either you're doing emptying a drainage bag or you're doing bedpan and measuring output. Either way, whether you get one or the other or you get both, you're probably not going to get both. You have to be very careful with your urine. And I'll tell you why. When I teach my students, I tell them, be very, very careful with how you handle the urine. Do not be very presumptuous and think that, the test observer, the RN test observer knows how much urine is in it, so I shouldn't worry. No. And it's happened in my class many times where someone actually goes, measures the urine, and then they discard it, and they cannot get credit. Why is that? Well, I don't know how much urine you got. I don't know how much you emptied, or I don't know how much the patient went. So do not be presumptuous. So how do you need to do this properly? First and foremost, and this is how I teach, and I'm hoping that it helps you. If it is the bedpan and the output, what I do is I just get the patient care out of the way. In other words, I kind of rearrange the steps a bit. In the state that I teach, they have you taking the urine out, go measure, come back and wash the person's hands. What I've found is that a lot of my students forget to wash their hands after they're done with the urine. So I'm like, how do I deal with this? Simple. So what I started to do is after the patient is gone, into the bedpan, for those of you who actually think it's urine, it's not urine. Okay. And you go, before I take the bedpan away to go measure the urine, I'm going to take care of patient care. What do I mean? I'm just going to wash their hands. That's an important part of your skill, because if you use the restroom after you're done using the bathroom, if you wash your hands after using the restroom, then your patient should be the same way. So you help them wash their hands. I lay them flat on the bed, and then I go for the bedpan. Again, I don't want to play with urine. If you've been through my class or any of my coaching classes, you will remember this. I don't play with the urine. So I take the urine out. Again, in that same vein, at this time, because I teach my students anytime you're by the bed needs to be up, and that is the truth. That is good technique. Remember, I teach you a good technique to pass, to impress your test observers. So what I do is when I take off the bedpan, what I then do is I speak to the situation. Yes, I do that because it's something that would impress me. So follow me here. Imagine a student, wash the hands of the patient, lay them flat, get it out, the bedpan, and says, you know what, I know this bed should be flat. I know it should be low to the ground. I know the side rows should be down, but right now, this urine is an important part of this skill. I am going to go measure it. I'll come back and take care of this situation. You can use your own words. Now, if any student does that to me or shows me that kind of skill, I'm going to be rooting for you. I don't want you to fail, because I can promise you right now, nobody else does it like that. Okay? So I don't see how you will fail that. Just speak into the situation. Now, I have had students, after they've gotten the bedpan, they used to go ahead, lower the bed, lower the side rail, make the patient comfortable, give them the call light. That's Amy Cookie points. You don't have to, but it looks good. And then they go measure. It's entirely up to you what you want to do. But I teach my students also to speak to the situation. So when you go to measure the urine, make sure you are at eye level. Do not call out. Please be very mindful. Do not call out the volume that you've measured of the urine. That's HIPAA. Don't call it out. There's no need for that. Your job is to go ahead, measure it at eye level. You got to squat or you stoop. Whatever it is you do, don't raise it up. You cannot do that. Just find a way. And I'm going to attach my video, because again, I already have these videos in my video library. So you go ahead and watch how I did bedpan and also draining, emptying a urinary drainage bag. They're all there. But this is me just helping you to give a rationale on why I teach it the way I do. Okay, so stooping, eye level on a flat surface, and then you make sure you record it. Have your previously signed recorded sheet. So they're going to provide you with a recording paper. Make sure you sign it. Make sure it has your name. You are the candidate. I've had students put in the name of the patient as the candidate. No, you are the candidate. Put your name on there. Make sure you're reading the milliliter part of the graduate, not the ounces. You need to know that. Make sure you record on the part that has ml or cc on it. Okay, and then once you've done that, record it and make sure you get the RN test observer to come check behind you. Again, you're being tested on not only your observation but on your measuring ability. Okay, so don't be presumptuous that they know and then you go ahead and then you discard it. Don't do that. Again, if you watch my video, I explained all this thoroughly, but I'm also still going into this. We're doing the Q&A because people need the how-to, the rationale. Why am I doing what I'm doing? Why am I teaching it this way? So that's the way to do it. Make sure you get the RN test observer to come behind you, and then it's up to them to wave you away and say, hey, you don't worry. You're fine. I already know what's in there, because you do have a range, okay, that you cannot go over or under. But let them be the one to tell you it's okay. Go ahead. Don't be so presumptuous, okay? So hopefully, I hope all the tips I've given you is going to go a long way and is adding value to your skills. And if it did, please give me a thumbs up and make sure you subscribe and hit the notification bell, because again, I'm doing a lot of these Q&As and I'm hoping that I am giving you added value. So come back for more. So until I come your way again, be kind, be grateful, be blessed.